New tonight, pandemic stress is now linked to addiction relapse, and new studies reveal what may seem obvious, that frontline healthcare workers have even higher levels of anxiety.
And some say the stress led them into substance abuse. News Nation's Felicia Bolton joins us live to explain. Felicia.
Many of these frontline healthcare workers are, in fact, heroes, faced with intense anxiety and death on a daily basis because of the coronavirus. The combination of work and mental anxiety is leading some of these heroes down a dark path of substance abuse. But I discovered there is light at the end of this tunnel.
Everyone good?
It's a hidden secret, rarely talked about openly in the medical community. Healthcare workers struggling with addiction. California doctor Faye Jamali says she was one of them after a slip at her children's birthday party caused her to fracture her wrist in 2007.
My orthopedic surgeon at that time prescribed me, I think it was 100 pills of Percocet.
The then 40-year-old mother of two says she started taking opioids as a way to relieve stress. From there, she started to treat her own migraines by injecting narcotics to reduce the pain.
I kept telling myself, I'm a 40-something-year-old physician. I'm a mom. I'm a soccer mom. I'm a wife. I can't be an addict.
No one knew until one day she used off the clock at her job.
Went into the recovery room, said hi to the nurses, went straight to the narcotic machine. It's called Pyxis. Put my fingerprint on it, checked out some medications, hi, and went into the bathroom and injected. I woke up on the floor of that bathroom with the needle still in my arm, having vomited and urinated on myself.
The hospital took her badge, opened an investigation, and reported her directly to the California Medical Board. Then she revealed the truth to her husband.
I just rolled up my arms and I showed him these track marks that I had. And I thought, here it comes. And instead, he picked me up in his arms and said, sweetie, we'll get your help. And I think that's the first time I realized no matter how hard anything gets, the truth is what gets you to the other side of the pain.
From there, she started treatment on her own, recovered, and switched to a different medical field. And now speaks about her journey to other doctors struggling with addiction. Jamali says the stress she faced back then is nothing compared to what healthcare workers are facing now during the coronavirus pandemic. According to a study published in the National Library of Medicine, it is estimated that approximately 10% to 15% of all healthcare professionals will misuse drugs or alcohol at some time during their career. Addiction specialist Dr. Michael McCormick says the pandemic has caused that number to increase. He is the medical director of the healthcare professional unit at Caron Treatment Center and specifically treats medical professionals struggling with addiction.
We really began to see it probably in April or May, and it's continued since then, and it's actually recently been much worse over the last 3 months. So it affects them from a number of ways. One is, of course, increased substance use, whether it's alcohol or drugs, but it's also affecting them from an anxiety, a depression standpoint.
In most states, medical professionals caught abusing drugs or those who come forward are immediately referred to a PHP, Physicians Health Program.
So they want physicians to come into this program, go get the help that they need, which is typically an inpatient treatment in a facility like ours. You then sign a contract, which on average is 5 years, and that encompasses monitoring.
But in California, they are referred directly to the medical board and suspended until their case is reviewed, a process that could take 2 years.
The physician knows that he or she needs help, and they're afraid to go and ask for help because they're afraid they're going to lose their license or be in some bureaucratic 2-year period where they're not able to work and it kills their career. They're not going to ask for help.
McCormick says getting help for anyone can be the difference between life and death. And here's a possible first step if someone is struggling with addiction. The American Medical Association has chat rooms open where physicians can discuss the emotional impact of their work. There are also many resources collected by the American College of Physicians as well.